So has so-called do-it-yourself aligner treatment affected your practice very much?
I personally, it has not affected our practice at all. I think people, for me in my area that I practice, people feel like, there's a need for a specialist. There's a need for, the interaction with the orthodontist. And I'll be honest with you, I like my patients. I like seeing them, every 6 to 8 weeks.
I find that marketing on TV and everything else has just simply raised the awareness once again of orthodontic treatment. Patients come in, it's actually facilitated very friendly and open discussions about the advantages and disadvantages of different approaches. And if they want an invisible solution, we show them various aligner solutions that we have in the office and just how crystal clear the SLX aligners are. We show them that we can do their bite correction first, and that's virtually invisible, and then transition into the SLX aligners. The actual side effect for me is that patients realize they can't do it themselves, have no desire to do it themselves, have actually been an adjunct marketing program, if you will, when they seek out treatment that fits their needs. So I've got several patients now that are being retreated because they weren't satisfied with their online solution. And as you and I know from years of experience with it, it's very rigorous and meticulous setup processes to make sure that the aligner solution is going to meet the patient's goals.
Right.
No matter how sophisticated the artificial intelligence gets, it's never quite there. One of the things that I point out to patients when they come in, when they ask that question, what if I used this other process? I said, well, that's all fine and good. And the aligners may fit initially, but no computer knows how the teeth are going to move over the course of treatment. When one tooth fails to fit the aligner, then that means all the force systems change and none of the teeth are going to end up where they're supposed to be. That's a very easy concept for patients to understand. And I have never yet had a patient go, well, I think I'm just going to go try it on my own after we sit there and talk about it.
Well, and you think about it, you're moving a tooth three-dimensionally. So you're going to have somebody, at these companies that are going to be tipping, the computer's going to be tipping the teeth. You can get alignment in so many different ways, as you know.
Right.
You can go in there, you can do interproximal reduction. But a lot of times you may be lining the teeth up, but are the teeth properly torqued? Are they properly rotated? Are they properly intruded or extruded?
Yeah, do they fit in the face?
Do they fit in the face? Are they following the smile arc? Are they doing so? There's so much to orthodontics that isn't being said in this story, where we're able to provide not only healthy bites with the incorporation of motion now we're able to fix the bites vertically. We're able to get the expansion that we want, and then we're able to get the teeth, whether we need to intrude the teeth or extrude the teeth, we're able to get them in a three-dimensional, perfect alignment when it comes to alignment, not just tipping the teeth into place. When I submit a case, I am typing up precisely on how I want the teeth to move.
Sure.
So I'm the orthodontist. I'm treatment planning the case. If I want expansion, I'm telling the technician I want this much expansion. If I want torque, I'm telling him this. When they get the scripts, they're setting up the case that I'm prescribing for the patient.
Exactly.
And that's the biggest difference.
If someone gave me a Stradivarius, it may be the world's greatest violin, it would still sound like a screeching chicken if I played it, And so the orthodontist, in the respect of using aligners, regardless of what system it is the virtuoso and takes the instrument. And in my hands, the SLX clear aligners have been a tremendous instrument because they meet the patient's demands and my needs as an orthodontist too.